Thank you for that introduction, and thank you to THCC for having me here today. I'm going to be talking about a little bit the maternal health insurance landscape and maternal health enrollment and that sort of thing. So let's see. It's just an outline of my presentation. What we do at Family and Children's Service, we have 3 different healthcare access programs, Navigators, and Connecting Kids to Coverage program, which helps with enrollment, renewal, post-enrollment assistance with TennCare, Cover Kids, and Marketplace health insurance. And then we also have a Health Assist program, which helps people who are uninsured or underinsured get access to the healthcare that they need, despite the fact that they don't have insurance or don't have the coverage, the full coverage that they need. As I mentioned, there's lots of different types of health insurance available out there for mothers. We mostly focus on those public health insurance programs, TennCare, which is Tennessee's state Medicaid system, Cover Kids, which is our children's health insurance program system, which is another state-based health insurance program. And then the health insurance marketplace, AKA Obamacare, AKA healthcare.gov, whatever you want to call it. It's another option for mothers in our state as well. So just a little bit of background. How many people are we talking about? Is this really important? We can see that as Brianna already mentioned, there's in general, there's about 50% of births in Tennessee that are under Medicaid, and then specifically just 2018, it was 65.5% of live births in Tennessee were to mothers who had TennCare or Medicaid. So that's about 52,851 mothers. These statistics come from the Kids Count data, which is great data center, has a lot of really informative statistics on there. But so this is a pretty significant population. This is a lot of mothers are affected by the policies that TennCare and Cover Kids have. And then Cover Kids, as of February 2021, there were 11,271 women enrolled that month in Cover Kids for pregnancy care. So another pretty significant program. We'll talk a little bit about the difference between TennCare and Cover Kids in a minute, but there's a lot of overlap with how they're managed, but they are different programs and have very different policies. So the policies that affect, it's important when you're looking at policy to look at the policy for both. And then this just kind of shows why is it important when we're talking about equity, why is it important that we talk about TennCare? Why is it important that we talk about Cover Kids? This is because we can see that they're in maternal care when in the share of births by payer. So who is paying for a birth in 2018, we can see that the majority of births for Black and Hispanic women were paid for by Medicaid. This is true for Asian Pacific Islander and Alaska, Native American and Alaska Natives as well. So we can see that this disproportionately, the policies of TennCare and Cover Kids disproportionately affect Black and Brown women, or Black and Brown pregnant women specifically. So TennCare, what are the options for pregnant women on TennCare? There actually are several different categories. It gets kind of complex. Who is eligible for TennCare when they have a pregnancy? There is a pregnant woman category for TennCare, but so you have to be pregnant, obviously, to be eligible for this category. But it's only up to 195% of the federal poverty level. So the federal poverty level is based on your income and your household size. For TennCare, that's month of application. So they're going to look at your income based on your household size. If it's over that limit, you won't be eligible for TennCare as a pregnant woman. Now, the TennCare application take up to 45 days to process. We know pregnant women do not have 45 days to wait to get their coverage. We saw that in Brianna's presentation, that this can be a barrier to getting good health care, that when women don't see a doctor for, several months into their pregnancy. So TennCare does have a program called presumptive eligibility, in which a woman can apply for, if she looks like she's eligible for TennCare based on her income and household size and immigration status, she can apply at the health department for a temporary TennCare to cover during the time when her full application is in process. So it is nice that there is this program available. The tricky part is you have to apply at the health department. And it is only available to women who are eligible for TennCare. If a woman's income is too high for the pregnant woman category, there is a medically needy spend down category, which allows, basically the eligibility is that you take your income and you subtract your last 3 or 4 months of medical bills for your family. And if that is under a certain limit, you can still be eligible for TennCare even if your income's too high. So that's really nice. That helps some women that are maybe their income's a little bit too high for TennCare, but it does have resource limits, very, very limited. So you can't have a certain amount of money in the bank, no savings for a rainy day, anything like that. So that is very, very limited. And then there is emergency Medicaid. If there's a case where a pregnant woman doesn't have coverage during her whole pregnancy and goes to the hospital to give birth, it is if the hospital applies for emergency Medicaid while she's in the hospital, then TennCare could cover the birth. But that's pretty rare, and it has to be applied for at the hospital day she goes into the hospital, which we know a lot of things are going on day you enter the hospital. It's very difficult to get those applications in. And then I've been talking about Cover Kids. Cover Kids is Tennessee's program that's called the Children's Health Insurance Program. It's another, it's not Medicaid, it's slightly different, but it is administered by the state and administered through the TennCare system as well. So the application is the same as the TennCare application, the call center is the same, it's all administered through the same program. With Cover Kids, pregnant women can be eligible for this up to 250% of the federal poverty level. So it does provide coverage for those women whose income is too high for TennCare. They can still be eligible under Cover Kids. And then this is really critical for Cover Kids as well. There are no immigration requirements for pregnant women applying for Cover Kids. So unlike TennCare, which has pretty strict immigration requirements, women who are pregnant can still get Cover Kids regardless of their immigration status. And this is true even for pregnant women who don't have any immigration status, who are undocumented, who have DACA, traditionally can't get any type of health insurance. They can be eligible for Cover Kids for the duration of their pregnancy. Other eligibility factors, you cannot have any other type of insurance and Cover Kids at the same time. You can't have TennCare and other insurance, private insurance at the same time. So a lot of times people might have employer-sponsored insurance, but it doesn't cover, you're still paying thousands of dollars for a pregnancy and birth when you have private insurance. So if they're income eligible, they can have TennCare and the private insurance at the same time, which really helps with those costs. But you can't do that with Cover Kids. So if there was a woman who, it's a tricky situation that a lot of women find themselves in. They have employer-sponsored coverage, but then they find out that they're pregnant and that it's going to cost them thousands of dollars just to have a healthy pregnancy. They're interested in getting Cover Kids, but in order to get Cover Kids, she would actually have to cancel her other insurance first before getting on Cover Kids. And a lot of times your employer insurance won't let you cancel unless you have proof of other insurance. So it's kind of this catch-22 situation. So it can be really a barrier to enrollment for some women. And then what frustrates me the most about Cover Kids is that there's no presumptive eligibility. So unlike TennCare that says, we know you guys don't have 45 days to wait to see a doctor, we'll give you this temporary coverage while you're waiting for your pregnancy. There's no program like that for Cover Kids. So a Cover Kids application could take 45 days to process. And during those 45 days, a lot of times doctors won't see, OBGYNs won't see women unless they have proof of insurance. And so Cover Kids will go and backdate to the date of application. They'll cover date of application and anything going forwards, but you might not know you have that coverage for several weeks. You might not get your insurance card for a month or a month and a half until after you apply. So this can be a really big barrier to that first trimester care for a lot of women. So I personally do a lot of Cover Kids enrollments. That's my enrollment kind of specialty, if you will. Most of the enrollments I do are for pregnant immigrant women applying for Cover Kids, and this definitely is a big worry for them. They think, oh, I'm going to apply for coverage and now I can go see the doctor. But they actually have to wait several weeks more in order to go to their OBGYN most of the time. But one thing to note is that this pregnancy program through Cover Kids is actually an optional program nationally. And as of January 2020, only 17 states had taken this, what's called the unborn option. And the income limit doesn't have to be up to $250. So the median upper income limit for a pregnant woman throughout the country is 205% of the federal poverty level. So actually, in this sense, Tennessee has some pretty better policies than some other states in place. Even though there's a lot of room for improvement, we do have better policies than a lot of other states in the sense that our income limit is up to $250, and we have this Cover Kids option, especially for our immigrant women who are pregnant. I've had women who move to another state and say, hey, I just moved to another state. Do you think I can get insurance here? And I'm like, I don't, it's not necessarily true that you could. This is a little bit about what those programs cover. So TennCare and Cover Kids cover pregnancy care without copays. Cover Kids can have copays sometimes, but not for women who are pregnant. Same thing with TennCare. Sometimes adults on TennCare can have copays, but not for women who are pregnant. It does not include dental health benefits for adults. And this includes pregnant women. And we know that dental health is really important for pregnant women. And this is something that TennCare is not, or Cover Kids is not going to cover for pregnant women or any adults. It does include mental health. It does include physical health not directly related to the pregnancy. This was something that was added probably 5 or 6 years ago. It used to be the Cover Kids pregnancy coverage only covered what they deemed as related to the pregnancy. So if you fell and broke your arm, they could argue that that's not related to your pregnancy. We're not going to cover that. Now they realize that the full health of the mother is everything of her health is related to her pregnancy while she's pregnant. So they will cover full physical health benefits as well. And then the coverage is for the duration of the pregnancy and 60 days postpartum care. This is no matter how the pregnancy ends. We know that miscarriage is very common. It will still cover 60 days postpartum after miscarriage. So it doesn't matter how the pregnancy ends, it'll cover those 60 days postpartum care as well, but only 60 days. And then this is MCOs, so that's a managed care organization. TennCare and Cover Kids use Amerigroup, Blue Care, and United Healthcare as the different companies that administer the care. And then so through those managed care organizations, TennCare offers additional benefits for pregnancy care coordination. So they can actually get someone to coordinate to make sure that they're getting all of their appointments they need, getting all the additional care benefits that are available to them, and making sure that they get, and it's just, they're usually full of like additional benefits. Sometimes there's cash benefits to making your appointments. Sometimes you can get additional breast pump or other benefits to enrolling in their pregnancy programs. The trouble with this is you don't automatically get enrolled in one of these pregnancy coordination programs when you enroll in TennCare or Cover Kids for a pregnancy. You have to take that additional step to call, request, and enroll yourself into one of those programs. So we know anytime there's barriers like that, that's really difficult, and especially difficult for women who are facing other barriers in their life, whether they're immigrants, whether they don't speak English, whether you're facing other trauma in your life. If you've got to deal with other barriers, you're not going to take the time to go and try to figure this out. So there have been some recent changes to the coverage that's available. So you guys may have heard that last month, the American Rescue Plan Act was passed, giving states option for 5 years to extend pregnancy-related Medicaid and CHIP eligibility to 12 months, as opposed to that 60 days postpartum period, which is available right now. So that's really exciting news. It's going to make that more of a national policy for Medicaid and states, but that's not going to be put into effect until April 2022. Now, you may have heard last week during Black Maternal Health Week that Illinois was the first state to expand their Medicaid coverage to the full 12-month postpartum period. That's because they have what's called an 1115 waiver, which basically means with the federal government, the way Medicaid works is they have like basic rules for your Medicaid, and you can just have, the states can just get the basic Medicaid package, or you can apply for a waiver to change some things about that package. Tennessee also does have an 1115 waiver, which means that we as a state could do that same request that Illinois did to, we wouldn't have to wait until April 2022 to apply for that full 12-month postpartum period. In fact, a couple of years ago in 2019, TennCare was looking at having this 12-month postpartum period and dental benefits for pregnant women. These were options that they were actually already exploring a few years ago. And these were 2 of the 5 priorities for program innovations for how they were going to use their additional block grant funding that they had in their proposal to CMS. So, we've probably, many people on this call have heard about the TennCare block grant and lots of news surrounding that. But it is important to note that these are things that, in terms of maternal health benefits, these are things that they were actually already considering before, which means that, to me, that's really hopeful, because that means that they probably would consider them again. They already have recognized that these are things that are important coverage benefits to have. And then just some updates on the COVID-19 emergency response. Effective March 18th, 2020, TennCare and Cover Kids terminations have paused, so they're not terminating anyone off of coverage. However, there's big exceptions for maternal health care in this. Some of the exceptions are if someone requests a voluntary termination or if they move out of state. But in terms of maternal health benefits, if someone is covered under Cover Kids for their pregnancy and they don't have an immigration status that's eligible to continue coverage, then their coverage can still terminate after the 60 days postpartum care period. And also that presumptive eligibility, if a woman applies for presumptive eligibility for TennCare and she doesn't fill out her full TennCare application, her presumptive eligibility will not continue. That will end as if she doesn't fill out a full application to continue her benefits. So there actually are instances where pregnant women can lose coverage even during the pandemic. And then all TennCare and Cover Kids renewals have paused during the end of the emergency as well. What do we do to help, to advance prenatal care and postnatal care here in Tennessee? We try to do this through several ways. At Family and Children's Service, we partner with prenatal clinics like the St. Thomas Holy Family Clinic, La Paz, even WIC, and Matthew Walker. Health departments will often refer to us to help women through the application process. Applying for coverage is just a first step. So we work one-on-one with clients. This is kind of skipping down to the bottom, but we work one-on-one with clients to help them submit documentation, help them walk them through the process of applying. And then also after post applying, any problems that they have getting their health insurance cards, understanding their benefits, that sort of thing. We're really there to help them understand how to use their benefits to the full extent and make sure that they are enrolled and stay enrolled as long as they can be. And then we work with clients. Sometimes there are, as we talked about, barriers to enrollment, literacy, access to technology is a big one. The best way to apply for TennCare is online. And so if you don't have access to that technology, that can be really difficult. And then we also work directly with TennCare to address those barriers to enrollment and see how we can improve them. So we have been able to, for example, TennCare changed their system in 2019. And during the crossover of that, there were hundreds of Cover Kids applicants for pregnancy where their applications were just not getting processed. And so we were able to send those cases directly to TennCare, and we were able to work with them to identify why that was happening, where it was happening, and to fix that problem in the system. And then same thing now with the TennCare website, we have seen glitches to the Spanish version of the website. We've seen login issues. There were issues with their phone loop. Anytime we see systematic barriers to enrollment like that, we're able to tell TennCare, hey, we noticed this is going on. Here are a few examples so that they can look into it and fix the issue. So it's been really helpful to be able to do that and have been able to increase, women's access to care that way as well. And then this is just our connecting information. And that's it. Sorry, I ran a little over time. So I'll just hand it over. Thanks.